of all, welcome to our Mental Health in the Workplace seminar. Um, you probably have been hearing in the news recently and through the media that chambers of commerce and boards of trade are going to be circulating or distributing the new antigen rapid COVID test. And not all chambers in Ontario, but a number of them have signed on, and we are one of those. So we're hoping that in the next couple of weeks, you'll be able to uh, go on to our portal through our main website and fill out the order form. And as long as you have less than 150 employees, we'll be able to provide you with those kits free of charge, courtesy of the provincial government and some funding from the federal government to support that. And hopefully that'll be helpful to you in your workplace. And it doesn't really matter how many people you have, how few or how many, as long as you have less than 150. Anyone with more than that can order them directly from the provincial government on their website, and they arrange for them to be delivered directly to your property. So without further ado, um, as I said, welcome to our Mental Health in the Workplace seminar, sponsored today by Bell Let's Talk. Be sure to stay with us to the end of the event, as Bell will be giving away a wellness package. I'd also, before we get started, like to thank our corporate sponsors who have continued to uh, support the Board of Trade throughout COVID. A list of those is going to be up on the screen. There they are: Wilson Vukovic, Bell, TD, and Casio. Thank you so much for being uh, supportive of the organization, and during these difficult times, we really sincerely appreciate it. Now, it's evident, obviously, in this last year that COVID has certainly taken its toll on people. I, I, I used the analogy early on in that when you break your arm or you have surgery, the surgeon will tell you, or the doctor will tell you, the cast comes off in 6 weeks, or you'll feel better in 8 weeks, or whatever the case might be. The, and we all like to know what the end of that time frame is going to be. The problem with COVID, I think, and I'm sure that our two panelists, doctors, specialize in this, is that the cast comes off and then we get another one put on, or we're told after 6 weeks it's going to be 6 more weeks before the cast comes off. And I'm sure that plays havoc with anybody's mental health and their well-being. Um, in any case, with May being Mental Health Awareness Month, and this being a topic that has become a top priority for all, we thought it'd be best to speak to some experts, of which we have two today to join us, to help to break the stigma around the whole discussion around mental health challenges, especially in the workplace, and how to best look after yourself and your employees. So without further hesitation or ado, I'd like to introduce a great friend of the Markham Board of Trade, Lena DeMarco, who's the Regional Director of Bell Community Affairs, to talk about Bell and to introduce our first speaker. Thanks for joining us.
Thank you, Richard, and hello, everyone. On behalf of all my colleagues at Bell, let me say what a pleasure it is to join you today and how proud we are to support the Markham Board of Trade and this virtual mental health event. Today, in what is becoming a familiar format, rather than have the actual event live in person, we are going to be treated to what promises to be an enlightening virtual event with keynote speakers, Dr. Noah Lazar and Rabiah Usman. Before we begin today's event, I want to take this opportunity to thank all our elected officials at the municipal, provincial, and federal levels for their hard work and dedication during what was likely their most challenging year in office in the midst of a global pandemic. And as well to thank all frontline workers for your dedication and support during this very difficult time. At Bell, we have been committed to doing our part to help Canadians as an essential service during COVID-19. We know how many people and businesses rely on our world-class networks, and we are proud our network has supported an unprecedented surge in demand. In addition, we have further increased capacity to ensure service availability, as well as heightened support for organizations providing critical services. Bell has been committed to further funding mental health campaigns during the pandemic through the Bell Let's Talk initiative, providing an additional $5 million in funds. We also acquired 1.5 million protective face masks to help equip health and public frontline workers, and we are helping to begin setting up some vaccination clinics with other private companies to help communities in which we operate. And now I have the pleasure of introducing our first speaker, Dr. Noah Lazar. Dr. Lazar offers assessment and cognitive behavioral therapy, CBT, for a wide range of difficulties, including for depression and anxiety. He is certified by the Canadian Association of Cognitive Behavioral Therapies, CACBT, in the provision of CBT and is an adjunct lecturer with the Department of Psychiatry at the University of Toronto, where he teaches the CBT seminar for second-year psychiatry residents. Dr. Lazar completed his Ph.D. in clinical psychology at Western University and worked in numerous inpatient and outpatient psychiatric clinics before beginning work full-time in private practice and co-founding the Downtown Psychology Clinic in 2019.
Thanks, Lena. And thank you, Dr. Lazar, for joining us today. Let's start off. We know COVID has presented a number of challenges for all of us this past year. And I guess when it comes to our mental health, it's something that we may not be aware of and kind of sneaks up on us without any evidence, or we're just not aware of what it is and how it's affecting us from day to day. Could you start by walking us through how to know if you're experiencing any mental health issues?
Absolutely. And I think for a lot of people, it's not an unfamiliar thing where it does sort of sneak up on you, especially as the pandemic, gets longer and longer. It's kind of that analogy of the frog in boiling water, where you turn up the heat a little bit, and you suddenly don't always realize you're maybe experiencing a lot of anxiety or depression. Common signs to look out for, things like low mood, feeling more stressed in general, increased worry. So if you're doing a lot of rumination, a lot of what if kind of questions where, thinking about what might happen or how things are going to play out, often that leads to you not being able to sleep very well at night. Some people find themselves a little bit more irritable than others. People may also find a lot of difficulty concentrating, low energy, muscle tension. So a lot of my clients are getting increased headaches or things like that. Those are, I think, the main things to look out for in terms of, whether there could be something going on.
Okay. And I guess one of the really high priority questions that we hear about are, one is, what are some of the difficulties of working from home? I mean, lots of people say they like it and they love working from home. Others don't. I remember the whole discussion changed from when COVID first occurred and everyone's saying, oh, great, we're all going to go home and we're never going to have to go back to work again. And now that's changing. That story is changing a lot. And people will be, in some cases, begging to go back to work again. But tell us about some of the difficulties of working from home.
Yeah, I am definitely one of those people who can't wait to get back into the office and see colleagues and clients face to face again. I think especially with the way things have gone, where, we've been asked to work from home, then we may be going back to work, then back to working from home. There's been a lot of shift. It's really caused a lot of disruptions in people's daily routines. And sometimes it's hard to kind of find your footing once the disruptions have been occurring. So, if you usually got up at the same time, had a commute to work, took breaks at a certain time, took lunch with certain colleagues, went home, and kept things pretty structured for people. Now, I think when people are working from home, they're finding, oh, I got up half an hour later than I normally would. I did some laundry during that meeting. My kids are doing online learning. There's a lot of competing demands and priorities. And so the boundaries between work and home are generally getting quite blurred. And you've also lose the social contact that I think a lot of people crave, even just popping by an office and saying hello to somebody or having someone to have lunch with. A lot of our, social network tends to be work colleagues because we spend so much time with them. And so I think what a lot of people are struggling with is sort of finding their footing in a lot of those routines, and how to sort of bring back that social contact, because people, I find, at least the people who don't like working from home, are finding themselves to be quite isolated right now and really craving a lot of that contact. And so trying to find ways to increase structure, increase sort of boundaries between personal and professional life, whether that's time-wise, whether that's your physical space, and really trying to introduce opportunities to have some socializing, whether it's with friends or a colleague, have a virtual lunch, something like that, that can actually really help sort of normalize things a little bit.
You know, it's interesting. Just before COVID occurred and leading up to it, a couple of years prior to that, we saw many convergence centers and collaboration spaces being opened up all over the place. They were the hot item. And it astounded me that after COVID occurred, you started having commentators saying, well, we're never going to go back to the workplace, and we're going to be working from home virtually for most cases going forward. And I think it's so contrary to what we saw happening, where people who in fact were working from home and were looking for a place to go out and rent some space to collaborate with other people and be able to spend a bit of time outside of the home and as you say, network, talk, and socialize. We all miss those water cooler discussions. How can, you mentioned mood swings and lower mood issues. How can one deal with lower mood in isolation?
So low mood, I find, is one of the more commonly pervasive things that people are experiencing. You're seeing it a lot in the news right now, where people are talking about that experience of just languishing a little bit until the lockdowns sort of end. One of the things that I think can actually be really helpful is trying to sort of come up with activities. Generally speaking, activities that would give you a sense of accomplishment, activities that would give you a sense of enjoyment, something that you find meaningful, or maybe something you've always wanted to do. It doesn't have to be a big thing, but trying to schedule those things throughout your week so that you always have something to look forward to. And when you're doing it, usually it takes a little bit of effort to get started. That's usually the hardest part. But once you get going, most people usually end up enjoying it or feeling really good about themselves when it's done. And that can often pull the mood up and provide sort of a good distraction around, times maybe you're just sort of thinking about stuff and ruminating quite a bit. So it's a good way of sort of pulling up your mood and sort of setting, I think, some limits around, I guess I'd say also setting some limits around sort of when your workspace is, when your personal space is, and carving out that time so this is my time to enjoy something. That can also give you a pretty good boost.
I think what a lot of people might be finding that complicates or compounds the difficulty. I know myself when I'm dealing with stress at jobs, or I went through a phase of renovating houses, which was particularly stressful. But I used to go to the gym, and for that hour or hour plus, your mind just kind of deals with the physical activity, and you forget about, it seems to just fade away, the stress that you might have dealt with during the day at your job or whatever other things that you're worried about. So the fact that that kind of element of exercise, and right now golf, and the other tennis and all the other things that have been taken away from people, I'm sure is compounding this whole issue that we're talking about, making it more difficult for an escape.
Absolutely. And I think what I've often told people is, like, we have our normal coping strategies when we are feeling distressed or when our routines get disrupted. And on top of just having the disruption, we also don't have the same outlets that we would normally use to try and de-stress. So you do have to get a little creative to kind of figure out, especially with all the lockdowns, like, how could I find something that would maybe approximate it a little bit? Even like trying a new hobby, something on your bucket list that you normally wouldn't have done. I've tried to do a little gardening myself, which hasn't ever really been my thing. And you know, I'll tell you, it feels kind of nice when you see you didn't kill the plant. So gives you a little mood boost.
It's true. And actually, one of the companies who are members of the Board of Trade and is a sponsor, Casio, they have experienced a huge uptake on musical instruments. Um, so a lot of people very early on, in fact, when this all first started, were buying digital keyboards and all kinds of various music, guitars, all kinds of things that you might not have thought about, and have been taking these up as things they can do on their own for sure, and have the time now to use them as a distraction. And so we may end up with a whole lot of very talented musicians when this is over. So you touched on this earlier. Maybe we can go a little more in depth about how can we manage worry or negative thoughts, because when you're on your own, they can tend to overwhelm you.
Yeah, and you know, at the core of worry, when we think about it through a CBT kind of lens, we often think about worry as really stemming from uncertainty. And I think you kind of hit on it that at the beginning, you know, where you're putting on your cast and then you're told 6 weeks and, oh, maybe another 3 weeks and maybe another 9 weeks and, oh, you'll get out of the cast at some point, but who knows when. It can be very disconcerting because we typically like to know what's going on. We typically like having a certain level of understanding or control. And when we don't, it often sets off a lot of what if type questions. So, you know, what if, you know, the lockdown continues past June? Then what if, you know, the support won't be enough? And then what if I can't keep my rent? And what if, what if, what if? And usually those what ifs will go into the worst case scenario that you can possibly get to. And that causes a lot of anxiety for people. So there's a couple strategies you can try. One is to see if this is a sort of a potential problem, or if this is a current problem that you can actually problem solve. So if it's something that you have control over, if it's something where you can actually execute on developing a plan and solving the problem, then going into a problem solving mode is actually a really good idea. But a lot of the stuff that people are worried about tends to be things that are outside of their control. We don't know if they're going to happen. They may never happen, but the fact that it's possible they could happen is really what creates a lot of the anxiety. So one strategy there is to try and actually distract and refocus. So when people are ruminating about those what ifs and it's going on for a really long time, if you're able to break the cycle by really just refocusing on an activity that sort of competes with thinking, you know, so something that would really grab your attention, it might just break the cycle briefly so you can pull yourself out of it. Another strategy you can try is one that we call sort of probability re-estimation. So a lot of times when we worry, we tend to overestimate the likelihood of the negative event occurring. And so sometimes, you know, somebody comes to me and says, you know, what if I go to the grocery store and get COVID? You know, we can pick numbers, you know, how many cases, active cases are in your area? So what are the chances you run into anyone at the grocery store? How does using PPE reduce that probability further? If you've had a vaccine, how does that reduce the probability further? And all of a sudden, what people sometimes think is, you know, oh, it's a 50% chance, suddenly becomes 0.01, and the anxiety comes way down. So that's the other way you could try to handle it.
And you know, we actually have, it may be unfair to say this, but we have two very different groups that COVID has affected. People who have lost their jobs because their businesses have shut down and they've lost their source of income, and they're dealing with not only all the issues that we've been talking about, but now compounded with the fact that they don't have a revenue source other than maybe one of the government served programs or so on. And we go the other group who really have continued to be paid, or they still are employed in one way or another, but they're not in the office, and they're dealing with the isolation and these issues, but they're dealing with it from a different perspective than the people who have lost their jobs. And both of them, I suspect, and you might want to comment on this, is they're both dealing with it. It's as difficult for one as it is for the other, even though they're very different issues.
Yeah, I think, you know, when people, have sort of lost their livelihoods or lost their business and they're reliant on CERB, it adds, I think, like a whole other dimension to the uncertainty, because at least, if somebody is still getting paid, they're still employed, that's something they don't have to worry about to the same extent, but they may be worrying about other things, such as what if I lose my job, or what if I'm not productive enough, and so we see almost similar we see similar worry, but the topics are a little bit different. And I think for the people who have genuinely lost, their businesses or their jobs or their income stream, I think there is some legitimate uncertainty about what would the next steps sort of be. And one of the things I do try to tell people is that's a very difficult situation to be in. It is very stressful. And sometimes it's not about fighting the anxiety. Sometimes it's about almost allowing for it to be there and then figuring out what your next steps are. Because when you don't know where the next paycheck may come from after CERB, that is anxiety provoking. And if you weren't anxious about it, that would probably be a little strange. So it's a genuine emotion, and it's okay to be stressed. It's just, how do you work with it to take the next step forward?
Yeah, difficult time. You had talked about sleep and the how all of this stress and mood swings and those sort of things can affect your sleep. What are some strategies that people can maybe learn to help them manage sleep? Because without a good sleep, all of these other things become even worse.
Yeah, actually, that's a very good point, because when you're not sleeping, certainly your emotional bandwidth almost feels, lessened. So when people aren't sleeping well, their mood decreases, their anxiety goes up, which actually then makes people not sleep well. So part of it, I think, is trying to deal with the emotional stuff that's going on. And if somebody is feeling depressed, if somebody is feeling very anxious, it may be worth trying to reach out for help to try and deal with those issues that are presenting themselves. There are a few tips sort of under the umbrella of sleep hygiene that sometimes can be effective for some folks. We talked about kind of keeping that routine. So having a bit of a similar wake up time, a similar bedtime is very helpful. It keeps you on sort of a 24-hour clock. So your body then kind of knows when it's time to go to sleep. Also, I know a lot of people, when they're working from home, just, because of space issues and so on, they're working in their bedroom, they're maybe working in their bed. You want to try to keep the bedroom and the bed in particular just for sleep. So you don't want to do activities that are wakeful, because then your body sort of conditions itself that this is a place where I should be awake and alert, rather than this is a place where I should be going to bed. A lot of times people also, when they're not sleeping, they start to get worried about the fact that they're not sleeping. And so you often then check the clock. Oh, it's 1 o'clock. It's 1:15. It's 1:30. I'm still not asleep. Oh man, it's gonna be a terrible day. It's 2:30. I would try to take the clock away from yourself so that you really have no idea what time it is. It usually only increases stress. But even with the missing clock, if you feel like you've been awake for maybe about 20 minutes, instead of tossing and turning, the best thing to do is actually to get out of bed, do something distracting, look out the window, read a magazine, something like that, just for a couple of minutes. Don't watch, an action movie that's going to get you all riled up, but something calming, and then try to go back to bed, just to, again, hopefully break that cycle a little bit. And sometimes sort of having, not trying to do work before bed is actually not a bad idea. I know sometimes we have to, but especially if your sleep is disrupted, trying to avoid anything stressful or wakeful, giving yourself like maybe a little bit of a wind down routine so that it's clear that it's bedtime and you're not gonna answer a stressful email right before you're trying to sleep. That can really help wind things down a little bit.
I've actually heard before people, and we know lots of people who have televisions in their bedrooms, and I've heard that that's not a good thing to have a television in your bed where you're watching movies or whatever, that the TV should be in another room, and that the bedroom is a sleep place.
Even people will say, like, a lot of people read in bed, and they'll even say then, like, you're better off to read in a different room until you get tired and then go into your bed. Because again, reading is kind of a wakeful activity.
It has been, you were talking about the body clock and how our time frames have changed and working and that sort of thing. And I do hear frequently from our members, and I even experience it myself, that when we're in these lockdowns, you kind of think, well, oh, I'll go and log into my computer and check my emails, and it's 8 o'clock on a Friday night. Well, there's nowhere else to go, or nothing else to do, and it's very kind of distracting in one sense to go back and do some more work. But on the other hand, your whole schedule about when you work and when you sleep and when you go out for your walk is completely scattered now for a lot of people and completely changed. Dr. Lazar, thank you very much for your advice. We've got some other questions we're going to be coming back to a little later, but I'd like to introduce our other panelist. Rabiah Usman is the medical director of the Farm Addiction Treatment Center here in Stouffville. Rabiah is the medical director of the Farm Residential Addiction and Mental Health Treatment Center. And after returning to Canada 4 years ago as a foreign medical graduate, she began working at the farm in Stouffville. Truly dedicated to supporting and empowering others, Rabiah has helped others navigate their mental health, as well as assisting those in their journey to recover from addiction. Rabiah is passionate about volunteering and servicing the community, especially in her hometown of Markham, helping to improve the overall quality of care and service for all of us as her main focus. Thank you for joining us today. So,
thank you for having me.
my first question is, are you finding a difference between patients who were coping with or working on their mental health conditions pre-pandemic versus someone who is now new to dealing with these kinds of challenges post-pandemic and the issues that are underlying in dealing with these?
Yeah, so absolutely. I've noticed quite a significant uh, difference in the amount of patients that are now coming in struggling with persistent mental health conditions, with the most common being anxiety and depression. And the effects of the continuing pandemic on people's mental health are becoming increasingly prevalent in our patients and in people in general. So, for those that did not suffer from pre-existing mental health conditions prior to the pandemic, are facing the prolonged feelings of fear, anxiety, frustration, and the uncertainty, as well as various other stressors, whether it's their employment situation, financial situation, the social isolation, whatever the stresses may be, which has resulted in a lot more of our patients saying that they're struggling to cope at home. And even with the patients that did suffer with mental health conditions prior to the pandemic, they're struggling to navigate those same feelings of the isolation, fear, prolonged uncertainty, and the changes to their everyday routines. So, with all the factors combined, with the increased difficulty to access some support services, or even what activities they used to do to help them cope, whether it was a gym or support groups, uh, routine, all of those have kind of changed because of the lockdowns and the pandemic, causing a prolonged state of decline for their mental health. And something we try and remind our patients on a daily basis here is to stay focused on staying in the moment and what you can control right here and right now. And there's no right way or blueprint for their recovery or to the struggles that they have with coping and living with their mental health.
You know, you bring up a very good point, which I actually never thought of before. But in groups that used to get together, to get like AA, for example, where they would get together and have a coffee and talk about their challenges, now to do that in a virtual format, which I guess is the only way they can, whatever the group might be, is that as effective? Or are they finding that that's not working as well?
A lot of patients have complained that it's not for them. The virtual aspect takes away the accountability of actually going to the meeting and seeing others, as well as there's certain barriers that, let's say somebody doesn't have a good internet connection, or they don't have a group that they have that they normally go to, or the same people they normally attend with. So there's a lot of variables that not too many people are finding that it's helping them, especially with the accountability aspect.
Right, right. So to tie this into our business community, how can we, as managers, business operators, support staff during what is definitely a very stressful time?
So I think the best way to support staff during these stressful times and continuing onwards into the future, it definitely starts with removing the stigma of mental health in the workplace and creating that safe workspace environment so that staff members who are struggling to feel comfortable are able to seek help, and creating a culture in in whatever business or organization it may be, creating a culture that's based on honesty, trust, and open communication is the first step to start supporting employees. Because when an employee or employees are suffering with their mental health, it affects their productivity, their job performance, as well as their attendance. And when a business or workplace is able to focus on not just the physical well-being of their staff, but also the mental health or their mental well-being, you'll see results with better job performance, engagement within the workplace, and even employee retention. And I think the most effective way in supporting employees is providing employees with regular check-ins and that safe space to be able to come to you honestly and say, I'm not doing okay right now. Or, and also in turn, finding out what they need and supporting what they need to help them, because no two employees are the same and they don't have the same struggles. Also, encouraging your employees to practice self-care, promoting employees to take mental health days when needed to prevent the longer term disability or the longer term medical leaves, and providing resources to the staff, as well as facilitating maybe team building or team group activities when we can, of course. And then I think the most important thing as well for any employer or management team or organization is to also set the example and to model to their employees that they're practicing the positive coping techniques that they're wanting staff to do, and focusing on their self-care, as well as living that work-life balance and being able to communicate with their own employees honestly and openly as well.
That's a tough one. That is a tough one. I mean, if the employer themselves, and they may be in this situation, going through some stressful times, and I've talked to some business owners whose businesses are really heavily impacted, and they've had to lay people off. So they're going through the guilt of having to do that themselves and dealing with their own issues, and then trying to reach out to their staff and be able to find out how they're feeling it makes it probably even more difficult. And I'm sure we were talking about this earlier about the idea of everything being virtual. I think that even employees who would be in the workplace, who might have before shared some issues with another employee who was a friend of theirs, doesn't have that ability to do it. Maybe it's not the same doing it over the phone or doing it on a Zoom call as it would be if you were out at lunch and having an informal lunch with an employee like you normally would, and you said, by the way, last night, I couldn't sleep and I'm feeling kind of depressed, and you start a conversation. But even those kinds of things aren't occurring for people either.
Yeah, and that's the struggle with navigating the new virtual world, is how do you keep those connections with, whether it's your friends, family, staff members, coworkers, how do you keep that connection while navigating it online?
Right. We're all creatures of wanting to be social and be, most of us anyway, and or have a balance between that and our own private time. And now that such a chunk of that has been taken away from us, I'm sure a lot of people are finding this even more difficult. Could you give us an example of how you've helped a client approach talking with their employer about needing help or needing time off?
So that's something that comes up frequently when we're doing our initial assessments prior to patients coming into our facility. They ask, well, how do I talk to my boss about needing time off for treatment? Or I don't know how to approach them because they won't understand and I'll get fired if they knew what was really going on. And although we can't tell a patient what to do and tell them what they should or shouldn't do in that sense, but we do provide prospective patients with the confidence that having an open and honest conversation with their employer is the first step in getting help and getting support, and reminding these prospective patients that they cannot be penalized for seeking out help and support. However, they can be penalized if they do continue to drink or use substances on the job and making a mistake or any kind of error in judgment. Then you will be penalized and you will be fired, right? And most of the time, patients that do end up coming in are genuinely surprised how well their employers and how supportive they were when they did disclose their struggles with mental health and addiction.
This might actually be one of those times when employers are even more supportive because they may be going through it themselves and have that problem or challenge of stress and dealing with the challenges of their day-to-day business operations. So an employee coming to them and saying, I have these challenges. But again, and I don't want to put you on the spot, but I guess as an employer, what can you do? And this comes back to the type of employer you were, personality that you were prior to all of this happening with COVID. Were you the type of manager or supervisor or owner who employees would be comfortable with coming to and closing the door and saying, I have this problem? Um, because if they were not that type of individual before, and now they can't even come in and close the door, they have to do it virtually over a phone or whatever, that makes that communication even more difficult for that employee to approach that boss. How can the do you have any tips for those managers who need to get that barrier down so people are comfortable?
So I guess for me, the benefit is that we have still been operating throughout the pandemic, and we are in person because we're considered an essential service. So I don't have that struggle of having to do it virtually. But I do think that even just regular phone calls, check-ins, hey, how's it going? Have you been able to practice some self-care? Have you done anything for yourself? Kind of just going around it that way. Any kind of regular check-in will make an employee feel a little more comfortable, that they might in the future be like, okay, they cared. They genuinely cared about my well-being. So I can maybe trust them now to tell them I'm struggling.
That's a good point. Actually, one of our members who won an award from us this year for their Employer of Excellence award, they sent around a survey to their employees after one of their weekly meetings or bi-weekly meetings, and they asked them what their favorite pizza was. And then they ordered them the pizzas and had them delivered to their homes a few days later for during the dinner hours. So it was little things like that that kind of send the message that they're caring about you and thinking about you.
Yeah, and I think just little things like that, genuinely in this time where everybody is struggling in some sense with different aspects, the little things that show you care go a long way.
Yeah. How do you keep? We had a couple of questions from our registrants, people who are participating today. One of them is directed for you to answer, and that was how to keep mindset positive and not get caught up in the fear and divisiveness of mixed messages of mainstream and social media.
Well, I think for everyone, it is always important to be informed and to know what's going on. But I think the constant checking of updates and reading different social media sites, or even different Twitter pages and all the news articles that are not completely factual, that's where you get into trouble, because then you start believing in the WhatsApp forwards that come in. So sticking to verified news sources and just limiting some of your social media activity to maybe just look at something that you enjoy rather than looking at what's going on in the news or what's going on with the pandemic. I think that's the biggest thing, is going to verified sources and just kind of limiting your time spent on some of the social media channels.
That's good advice. Actually, I was a bit of a news junkie before all of this started and watched news broadcasts and listened to talk radio and all the time. And I've stopped. I've cut back significantly because you just get bombarded.
Absolutely. And that at the beginning of the pandemic, every day it's like, oh, what were the numbers today? Oh, what's going on today? Oh, this is happening. And now as time's gone on, I even realized that like I can't get so caught up in that, because then you worry about, are things gonna open? I can't do this, I can't do that. Just kind of, it is what it is in a sense. And you just have to take it as it comes, right? Everybody's in this together.
Um, our other question is directed for Dr. Lazar. So let's bring him back. What are the common early signs that someone is suffering from mental depression? And how do we initiate a conversation about it without offending them? It's actually a two-part question. And how do we convince someone who is in denial that they should seek help? There's a tough one. Oh, we need to unmute you.
There we go. I knew I was going to do that at some point. You know, I think
No Zoom event would be event without an unmute.
exactly. I think for a lot of people, some of the signs that we talked about earlier, you know, in terms of the low mood, sometimes people experience sort of like a lack of interest. So it almost comes across as like low motivation towards engaging in activities. People might, if they're a family member, they might see them in bed quite a lot. Some people tend to sleep more. Some people tend to sleep hardly at all. Some people will tend to, you know, eat a lot more than usual, or maybe putting on a lot of weight. Some people lose a lot of weight. The symptoms can be kind of various. If you're an employer, you might notice sort of decreased focus. You might notice decreased productivity. And it's tough because you don't necessarily know if that person's depressed, or maybe they're just feeling under the weather, for example. And so I think sort of, you know, what Rabiah was talking about keeping that very open sort of dialogue and sort of having a way for people to feel comfortable, even just going up to them and asking like, hey, how's everything going, is a really good opening line, because some people won't want to talk about it, some people will. And even once somebody is willing to talk about it, what they need is going to be very different. Some people might just need you to pull them out of bed and take them for a walk. And some people would respond very, very poorly to that kind of approach and just want, you know, you to just sit with them in bed and watch TV instead. When somebody though is really not willing to sort of seek help, so if they're kind of in denial that something is going on, it's very hard to get someone to engage in change behavior when they're either not ready or they don't even really admit there's an issue in the first place. Sometimes sort of keeping a sort of an open, respectful dialogue about some of the things that you're noticing or some of the concerns that you may have, not in kind of an accusatory way, but, you know, I've noticed you've been sleeping a lot more. Is everything okay? You know, I wonder, are you sure everything's all right? You haven't, you know, usually slept 12 hours in as long as I've known you. So you could kind of try to take it very gently. If you do come at it too strongly, that will often polarize the person and they'll be even more resistant. If you say, I think you're depressed, they're gonna say, no, I'm not. So really very gently and kind of, it's very difficult though to help somebody recognize there's a problem if they really have a hard time seeing it. And you know, sometimes that could be where some professional help could come into play. But again, it's hard to access if the person doesn't think there's a reason to access it.
Well, we had a question actually just posted from one of our in the audience, and it sort of touches on this, and I'm going to add. So their question is, I don't have your skill set, yours. How do I, as a manager or employer, help? And I want to add to that as well. and I understanding that neither of you are lawyers, but if you have an employee who you've identified as there or maybe think there's a problem, and you've both touched on this, I guess the question is how much or how do you tread into this kind of a conversation without getting yourself into a situation as a manager of saying, well, are you accusing me of being whatever, and becoming a legal issue then? And I don't know if either of you have had experience with this kind of thing. Rabiah, do you have any thoughts on this one?
I was waiting for Dr. Lazar because I thought he was going to go. In terms of having experience with that situation, no, but it is kind of a tricky situation in the sense of you can't penalize somebody for their mental health,
No.
but you also can't allow, because we see patients, we can't allow their patients to also be affected by it, and their lives are in our hands in the sense, right? So it's a very, it's like a thin line you have to tread, and it comes down to trying to be supportive and even just saying, okay, look, you need some time off, depending on the relationship you have. It's like, look, take a couple days and then see what happens. And it always depends on what the situation is too. What kind of struggles are they having? Is it an addiction? Is it anxiety? Is it depression? So it kind of varies depending on the situation.
Right. Dr. Lazar, anything to add to that?
Yeah, I think those are all excellent points. And I would say sometimes people can feel like because we want to help, we want to help people when we see them in distress. And I think it's just important to also make sure you're clear on the boundaries and the limits. Like, you don't want to segue into the employee's therapist or anything like that. And so pointing them to the right resources is probably a better approach than, having them come in, and you just don't want to blur those lines too much.
Right. It's interesting. A few years ago, I was working for an organization that ran different kinds of seminars. And one of the ones that we ran was stress management. And we used to talk about this internally in the office, trying to figure out how to market it because it wasn't cheap. It was a $2,000 3-day seminar. Um, and our struggle was, what employee would want to go into their supervisor or manager and say, is it okay if I spend $2,000 to take a stress management seminar? And they probably would be afraid to do it, or they're letting the cat out of the bag in a sense, and the manager could react to it in various ways. But you're right. It's a very precarious and fine line to walk when you're dealing with someone and you've identified that there is something that's wrong and that they might need help of one sort or another. Do either of you actually have any other, I was just looking to see if we have any other questions, and there are none. So do either of you have any other sort of overall comments you'd like to make? We have a bit of time left. I'll start with Rabiah.
I think the best thing that I could say is just that with this pandemic and with everybody struggling as a whole, I think it's now that since most people now have experienced to some degree the increased levels of anxiety and depression or a different mental health struggle. And it's now that maybe we can also understand people that are struggling to just be okay every single day, that had these struggles prior to the pandemic and even will continue after the pandemic once a lot of these stressors that we're experiencing are gone. So I think it's just a good way to help break some of the stigma. And I think it's a good way for us to be a little more compassionate towards people that do struggle with mental health on a daily, because now we've all experienced to some degree what it feels like.
That's true. Very good point. Anything to add, Dr. Lazar?
I think the main takeaway that I often think about with this pandemic is it's been tough on everybody. And one of the things I try to really just emphasize, and I'm guilty of not being so great at this sometimes myself, is just to really be kind to yourself during this time. It's tough for everybody. And it's okay to be depressed. It's okay to be anxious. It's okay to be angry. It's okay to be sad of feelings, you know, grief about things that we've lost in the meantime. They're all very normal emotions. And, you know, sometimes even just acknowledging that it's okay to not be okay is a good starting point to give yourself that self-compassion. And then there are a lot of resources out there to access, you know, various kinds of treatment. You know, there are some great programs that are funded through the Ontario government right now. There are people have, you know, potentially EAP programs at their work. They're all really great opportunities. If you need the help, it's a great time to make sure you reach out.
And actually, in adding to that idea of being kind to yourself, I've heard from a number of people who tell me that their employees and even they are not taking vacation time because they kind of think, well, I'm working on the hours I want to work, or I take a day off, you know, take in the midweek, I work 4 hours instead of 8 or 10, but they're not really taking a true vacation away from work and not going to the computer or checking their cell phone for text messages and that sort of thing. And I think that's something I would suggest to our listeners, having kind of experienced it myself, is you need to take a break, whether it's a long weekend or a week, uh, and get away from all these issues that we're dealing with on a daily basis. Um, Okay, I thank you both for your time. I don't see any more questions that have come up. So thank you for providing all these great tips. They're really very helpful. And I know that our registrants who have attended today also enjoy, even though it's a virtual format, they miss getting together. Our members really get together on a really regular basis and love seeing each other. And I can see the stress in their faces sometimes on these Zoom calls when they um, get on and they say, yeah, it's great to see each other, but we really wish we would meet in person. Um, we are going to be circulating a PowerPoint of Dr. Lazar's presentation after the event, and we'll be posting the recording of this event on our YouTube for you to be able to watch again or share with your colleagues. I'd like to bring Lena back on screen to do the draw for the Bell Wellness Package. So Lena, it's time to do the draw. And first of all, I really want to thank Bell. Bell has been amazing, not just in supporting events like this, and they do many of them in many communities, but Lena and her team are so supportive and wonderful.
I think I lost you there when you were saying something that's very nice. So you might want to repeat that. No, I'm just kidding.
I was thanking Bell and you for all of your wonderful support and the great things Bell has done.
I did. You faded away, so that's why.
Okay. Take it away for the draw.
Okay, and I know that Sarah's gonna do the wheel. Well, this is fun.
Oh, we're very high tech here.
Yeah, you've got the wheel going. And the winner is, of course, it's a name that I cannot pronounce probably, and I hope I do it just, is Neha Camera. That's who the winner is. Neha, last name Camera. So thank you, everybody, for this session as well. Thank you.
I was just looking at the chat line and questions, and we didn't get questions, but what we did get is a number of people saying how helpful this was and how great the information was, and very appreciative of you taking the time to be with us today. And like a Zoom call, we kept it just under an hour, so it wasn't too long. I just wanted to let people know, first of all, reach out to our Markham Board of Trade team should you have any concerns. We're always here to try to help you find advice with government programs and that sort of thing. Keep in mind, we also are Open in Markham platform, which is a free platform for businesses operating in Markham to put up information about what they're providing in the way of takeout or pickup or delivery, if it's a restaurant or whatever your business might be doing. We have 470 businesses listed on that site. We also, our chamber health plan and resources are there to help you. There is a portion of our Chamber's Health Plan, which deals with mental health and offers funds to be able to support and work with you on that. And Bill Hutton can help you with that information. And our next After 4 networking event, which I alluded to earlier, is Thursday, May the 27th. Again, thank you to all our sponsors. Thank you to our panelists and Lena. Stay well, keep positive, and test negative.
Yeah, same with everybody else. Thank you very much, everybody.
Take care.
Thank you.